Hello everyone and welcome back to MediInsights. Artesunate injection can rapidly save lives in severe falciparum malaria by clearing parasites fast and reducing deaths. In this video you will learn when to use it, how dosing works, how it acts, common and serious side effects, and key safety advice today. Starting with use of artesunate injection. Artesunate injection is the recommended first-line parenteral treatment for severe Plasmodium falciparum malaria because it reduces mortality and clears parasites quickly. You should use it when a patient has severe malaria features such as high parasite burden, impaired consciousness, respiratory distress, shock, or organ dysfunction, or when oral treatment is not possible. Once the patient improves and can tolerate oral medication, complete a full oral antimalarial course to prevent relapse. Next, dosage of artesunate injection. The usual intravenous dose is 2.4 mg per kilogram given at time 0, then at 12 hours and 24 hours, and thereafter once daily until the patient can take oral therapy. Administer the reconstituted drug as a slow intravenous bolus over 1 to 2 minutes, and follow your local product label or protocol for preparation and route options. Adjust dosing for practical weight-based calculations in routine care and consult pediatric guidelines when treating small children. Next, mechanism of action of artesunate injection. Artesunate is an artemisinin derivative that is rapidly converted to the active metabolite dihydroartemisinin. The active drug's endoperoxide bridge is cleaved in the parasite, producing reactive radicals that damage parasite proteins, membranes, and other essential processes, which explains the very fast parasite clearance. Because it hits multiple targets, artesunate works quickly against the blood stages of malaria. Next, side effects of artesunate injection. Most patients tolerate artesunate well, but watch for allergic reactions, transient liver enzyme rises, and common mild symptoms like nausea. A clinically important adverse event is post-artemisinin delayed hemolysis, where hemoglobin may fall 1 to 3 weeks after treatment and may require monitoring and supportive care. If you see worsening anemia, jaundice, dark urine, or extreme weakness after therapy, investigate for hemolysis. Next, important advices for using artesunate injection. Start parenteral artesunate promptly when severe malaria is suspected and seek specialist input if available. Monitor vital signs and laboratory markers, including hemoglobin and hemolysis markers for several weeks after treatment, because delayed hemolysis can be delayed. Once the patient can swallow, complete a full, recommended oral antimalarial regimen to prevent recrudescence, and follow local obstetric or pediatric guidance in pregnancy and in young children. Prepare and give the drug exactly as the product label or local protocol instructs. Thank you for watching MediInsights. If this video helped you understand artesunate injection better, please subscribe for more clear medical explainers and write any questions or experiences in the comments below so we can cover them in future videos soon.